Anxiety, phobia, and conscious sedation. Patients may experience anxiety, panic disorder, or phobia. Anxiety may cause a patient to experience an unpleasant state of tension, forewarning danger. Can be painful and persistent if the cause is unknown. Patients may experience anxiety severe enough to require them to stop a procedure. Common symptoms are nervousness, fear, palpitations, choking sensations, and fear of dying. Causes of anxiety. 1. Physical condition of equipment itself. Unable to see outside the tube, did not want to move in the tube, worried about the noise it will make. What modality are they referring to? Probably CT. 2. Emotional turmoil. Worried what the scan will show. A panic disorder. A sudden, unexpected, intense attack of apprehension. Physical symptoms include agitation, tachycardia, hypertension, cardiac dysrhythmias, SOB. Phobia. Psychological conditions that consist of irrational fear leading to avoidance. What's an example of a phobia that a patient may encounter? Claustrophobia is the fear of tight and enclosed spaces. Basic responses of patient. A patient undergoing these conditions may respond by having a decreased pain threshold, tachycardia, palpitations, chest pain, tachypnea, dyspnea, which is shortness of breath, GI distress, vomiting, and headaches. Conscious sedation. Drug-induced relaxation allows the patient to tolerate unpleasant procedures. Patient remains conscious but sedated, may be an amnesiac, which is a memory loss of procedure. Proper amounts of sedation will allow patient to remain cooperative and also reduce their anxiety and apprehension to the procedure. Patient will still be able to respond to verbal commands, maintain airway with adequate cardiorespiratory function. Conscious versus general anesthesia. Only difference is the dose of the sedative. General anesthesia requires mechanical ventilation due to the dose being so high. All sedatives used for conscious can incapacitate a patient's own ability to breathe if the dose is accidentally overcalculated. Considerations prior to sedating. Obtain an accurate history, physical examination, height, and weight. Assess heart and lungs, and document airway patency. Acquire a list of all patients' meds. This includes over-the-counter, alcohol, and vitamins. List all allergies. Ask when the patient's last oral intake of medication, fluid, and food was. What would happen if the patient ate and they were sedated? They would aspirate. List all known abnormalities of organ function. What to have available during sedation. Oxygen source and pulse oximeter. Monitor the oxygen saturation. Suction equipment, airway equipment, and means for providing positive pressure ventilation, i.e. a bag and mask. Emergency resuscitation equipment and meds. Pharmacologic reversal agents, flumazenil and naloxone. Intravenous equipment to maintain IV, cardiac monitor. Crash cart normally contains all of the above materials. Agents used for conscious sedation. Common medications that are used in the radiology department for conscious sedation usually consist of these drugs: a barbiturate, benzodiazepine, and opiate analgesic. Anti-anxiety medications. Barbiturate and benzodiazepine are both used to alleviate anxiety that is usually secondary to claustrophobia undergoing certain procedures. These meds act on a limbic system in the brain by enhancing the effect of the sedative neurotransmitter, GABA, and block stimulation in the brain. GABA is gamma-aminobutyric acid. Analgesic. Commonly used in combination with the anti-anxiety drugs for conscious sedation. By combining the opiate or narcotic, a synergistic action takes place to relieve the painful anxiety caused by the procedure. Opiates stimulate the CNS receptors and cause a decrease in the perception of pain. These drugs include morphine, pyridine, and fentanyl. Warning: although the combination of anti-anxiety with the opiate med is common practice, it is especially dangerous because of the effects of the patient's respiratory. Respiration depression can rapidly occur to the point of respiratory arrest if the dose is great enough. If this would ever occur, to reverse the respiratory depressant effects of the opioid, 0.4 to 2 milligrams of naloxone should be given IV or IM. To reverse the effects of anti-anxiety medications, use 0.2 to 1 milligram of fumezanil should be given IV only. Barbiturates decrease the cortical brain activity by depressing cerebral cortex activity by blocking the excitatory neurotransmitters like glutamic acid and acetylcholine. Capable of producing all levels of sedation, include medications thiopental, methylhexyl, and phenobarbital. Thiopental is commonly used as a surgical suite to induce full anesthesia. Used to be used for pediatric sedation. Newer drugs have replaced this. Given mostly through a urinary catheter inserted rectally, onset of action takes about 30 minutes, sleep duration normally 45 minutes. Major adverse reactions: bronchospasm, hypotension, apnea, respiratory depression, occasional excitation, agitation, and GI upset. Methotrexate, extremely rapid onset and very short duration, can be used for the brief procedures. Rectal administration, dose patient about 15 minutes before procedure. Patient will usually sleep between 20 to 90 minutes. In adults, this drug can have an even shorter time frame of action, about 5 minutes. Same adverse reactions as thiopental. Phenobarbital. This drug has a long onset of when the patient will start to feel its effects. Patient will receive the dose the night before in the morning of a procedure. This drug is administered orally. Mainly just keeps the patient calm. Benzodiazepines cause selective CNS depression, muscle relaxation, anti-anxiety, anticonvulsant, and sedative hypnotic activities. This class of drugs also blocks stimulation in the limbic and cortical systems of the brain and facilitate the GABA neurotransmitter. Commonly cause amnesia surrounding immediate events and block reflexes. Excellent absorption through the entire GI tract. Conscious sedation is long-acting than with barbiturates, but patients may feel the hangover effect. Most commonly used class of benzodiazepines is midazolam, or Versed. Adverse reaction, I guess that's what that's supposed to mean. Excessive drowsiness, hiccups, decreased dexterity, dry mouth, GI upset, headache, blurred vision, hallucinations, amnesia, respiratory depression if given too fast. It may lead to cardiovascular collapse secondary to extreme hypotension. Midazolam, also known as Versed, most widely used benzodiazepine for conscious sedation. Quick onset with short duration of action. Decreases anxiety and improves outcome of procedures by decreasing motion artifact. Given 15 minutes before procedure. Can be given IV or by mouth. Recommended to start the lower dosage range and repeat a dose that is 25% of the initial every 2 to 5 minutes as needed. Opiate analgesics stimulate the CNS opioid receptors to decrease the pain perception. When used in combination with anti-anxiety meds, the opiates allow decrease of pain and anxiety. 3 main opiates. Morphine, given on patients any age in IV. Meperidine is not recommended for pediatrics. It must be given IV. Fentanyl, given to patients any age, IV or transmucosally. Adverse reactions: excessive drowsiness, GI upset, urinary retention, dizziness, headache, lightheadedness, confusion, hallucinations, hypotension, and respiratory depression. Conclusion: conscious sedation is often used to decrease patient anxiety and pain associated with the medical and imaging procedures. The administration of these medications improves the outcome of the procedure. However, the imaging technologist must not forget the dangers associated with these types of medications. You should always be attentive to patients coming in your department of their prior history of medications received. The end.